I wanted to just open up and begin by asking you, where are we with the pandemic, and what should we know?
Well, first of all, Reverend, it's a real delight to be with you today, and thank you all for the work that you all do as we proceed in the pandemic and just in general. I mean, I think that your voice as leaders in the community, you are absolutely essential in helping us to save lives in this pandemic. And so thank you for the work that you're doing every day. In terms of where we are, I would say that we are at a crossroads because on the one hand, we have seen terrible surges in the past. We have seen a decline from the holiday surge, and we're now at a much better place than we were a couple of months ago. But on the other hand, we're still seeing more than 50,000 new infections every day, more than 1,000 deaths every day. That can never become normal to us as we go on in this pandemic. But also, we don't know exactly what's going to happen next. As in, on the one hand, we are getting vaccinations really ramped up, thanks to the great work of the federal government and local and state governments and private entities and all of you. We are now at between 2 and 3 million vaccinations in the US every day, which is really phenomenal news. But on the other hand, we also have the arrival of more contagious variants that really threaten whatever progress that we've made. And so I talk about this fork in the road because where we go from here really depends on the actions that we take today. So if we continue to increase our vaccinations, but continue to be on our guard, I really think that we are in for a much better spring and summer, and we could potentially reach herd immunity, enough vaccination that we could end this pandemic in 2021. On the other hand, we could let these more contagious variants take over. We could plateau at a very high level of infection, continue to see 1,000 deaths per day, and be facing tens of thousands, if not hundreds of thousands more deaths from COVID-19, which is an unbearable tragedy. So as it has been during the entire pandemic, where we go from here is up to us.
Thank you for that. You have talked on your social media about harm reduction, and I've also heard you mention this on CNN and other places. Can you talk a little bit about what you mean by harm reduction?
Yeah, so I am a professor of public health. I also previously worked in the city of Baltimore as the health commissioner for my city. And there is a concept in public health of harm reduction. And we know this concept initially through the work around drug addiction. Of course, we may wish that somebody isn't addicted to drugs. However, if they are, we know that needle exchange, as an example, will reduce their risk of transmitting HIV and hepatitis to others. And in the same vein, when I was in Baltimore, we had an initiative on getting naloxone or Narcan, the opioid antidote, to every single resident in our city, because we believe that if somebody is dying from overdose now, if we don't save their lives right now, we're not going to be able to get them a better life tomorrow. So this idea of harm reduction is you may not approve of whatever practice is going on, but knowing that it's happening anyway, how can we try to reduce risk as much as possible? So when this applies to coronavirus, we know that right now, not everyone is abiding by public health guidelines. The Centers for Disease Control and Prevention, the CDC, for example, currently is saying that people should not be engaging in non-essential travel. However, the TSA is reporting that air traffic is higher, or traffic through airports is higher than it has been during the entire pandemic over the last 10 days, that it's higher even during the Christmas and Thanksgiving surge periods. So we know that people are not abiding by what we're asking them to do. Look at the pictures of people on spring break. Clearly, they're not following the guidelines to practice physical distancing and masking. Now, of course, we want people to be doing this, but if we know that they're not, harm reduction is about reducing their likelihood of risk to themselves. And because we're dealing with a very contagious illness, the risk to others as well. And so a harm reduction practice might be to say, okay, you've gone on spring break. I wish you didn't go. But now that you have gone, when you come back, you should quarantine for 5 days or 7 days and then get tested so that you don't end up spreading the infection in your community. Also, harm reduction would be to say, okay, I know you want to travel across the country to see your loved ones and be in this wedding. Please wait until after you're vaccinated, because the vaccine is a major harm reduction practice. Wearing masks, another key element of harm reduction that protects you from others and others from you. And I hope it's that kind of practice that we engage in. And I think just another note about this, because I know we'll be speaking a lot about vaccines, I see harm reduction too as a compassionate method of approaching people, because I think so often in this country, unfortunately, we have been politicizing elements of the coronavirus response. And we are therefore prone to see someone who has reluctance, let's say, about vaccines. We label them in one category. And we say, maybe there's an immediate a sense of there's something wrong with this person, right? That they're anti-science, they're not listening to public health experts, what's wrong with them? But actually, I think we should approach people with compassion and empathy and listening and understanding where people are coming from, which I know is the work that all of you as clergy do every day.
That's true. I will have to confess that this morning, as I saw a video from the spring breaks, I was screaming at the TV, "Why are you doing this?" It was hard to watch, honestly, knowing everything that we do know. It was very difficult to watch some of the footage from over the weekend and seeing people not taking it seriously.
I know, and I will just say that for us as clinicians, I'm an ER doc as well, and for those of us working in the emergency departments, seeing what our patients are going through and the suffering of their families. And I mean, I don't know how many of my colleagues in this last year have done something that we never would have thought imaginable, which is to hold up a phone to our patient as their family members say goodbye to them. I mean, that's just something that we never really thought was the norm in practicing medicine, but that's happened. So we would go from the ER, walk out the doors, and see people without masks partying. I will say that that cognitive dissonance is really difficult. So I understand the difficulty of approaching people with this level of listening and compassion, but I think it's really important.
One of the things that you mentioned was some of and I appreciate you're kind of going over some of the safety measures that people should take in harm reduction. There's been some discussion about whether people should be 3 feet apart or 6 feet apart or as much as 13 feet apart. Can you just sort of clear that up for us? And one of the big questions that we often get is, when can we go back to church, really? Or when can we go back to worship or larger gatherings? And I don't know if you have any guidance or wisdom that you can share with us about that.
Yeah, I'll address the distancing question first, which is that there is no magic number, right? It's not as if at 5 feet, you're definitely going to get coronavirus, but at 7 feet, you're totally safe. I mean, the 6 feet is a rule of thumb. And so I think that's one way of thinking about it. The greater the distance, the better. And also wearing a mask makes a difference. In addition, being outdoors versus indoors makes a huge difference. Actually, studies have shown that being outdoors versus indoors reduces your likelihood of transmission by 18 to 19 times. So a major difference by being outdoors, because we know that this is a virus, the SARS-CoV-2 virus that causes COVID-19. This is a virus that is transmitted through the respiratory route, through large droplets, such as when you're coughing and sneezing, and also through aerosols. Tiny microscopic droplets that you exhale just by breathing or speaking or singing. And so this is why I would say outdoors, 6 feet apart, you're almost certainly to be very safe. Indoors, it depends on whether you're wearing a mask. I think if everyone is wearing a mask, 6 feet is fine. In schools with younger children, the CDC has said that 3 feet is fine, but that's for young children who are in school, totally wearing masks the whole time. Not the case for adults. So I would say adults, 6 feet indoors with masks, still still safer. Probably 10 feet is going to be safer than 6 feet. And then also would impact what activities people are doing. If the room is not well ventilated, everybody is shouting and singing, 6 feet, even with masks on, probably still has some risk. but 10 feet is going to be safer, especially if people are not singing as loudly. So again, I would look at this not as, at this point, it's not to say everything is 100% dangerous or 100% safe, but rather as gradations of risk. And so that leads me to answer your second question, Reverend, about the question about when is it safe to go back to worship. And I think that again depends on people's tolerance of risk. And I think it's at this point that we should talk about not just if is something safe, but is something essential, and how much value we put on that activity. We've been thinking a lot about this with regard to schools, that for many of our children, in particular children who are the most vulnerable, who are younger, in-person schooling is really essential. I think for many people, in-person church services, religious services are really essential as well. In which case the conversation moves from, is it something that's safe, to, is it essential? If it's essential, how can you make it as safe as possible? I would say encouraging people to be vaccinated is really important, because the vaccines that we have, they are nearly 100% effective at reducing severe disease, meaning that you are virtually protected from having severe enough illness that causes hospitalization or death. And I think for many people, once they're vaccinated, they would feel comfortable going back to church, because this is such an essential activity. And if there is risk of still potentially getting infected, but they're not going to get that ill that they could be severely ill, I think a lot of people would choose that as an activity that they really want to resume. I would continue to make sure, though, that people are masked. Masks, we know, dramatically reduce the risk of transmitting the virus. If you have members of the congregation who are elderly with medical issues, again, I would think about, are there ways to make it safer for them? Are there services that you can continue to do outdoors? Can you do some services where there isn't loud singing? Make sure that there is a lot of space in between members of different households as much as possible to accommodate those who are the most vulnerable. But I would say in this case too, looking at values and risk is much better than just looking at just in general saying, is this safe or unsafe? Because there's no such thing as 100% safe or 100% unsafe. And I also think that this is one area where we should really be encouraging vaccination. If everyone or nearly everyone in your congregation is vaccinated, that really is key to returning back to normal.
Yeah, that's really, really helpful. And I think very common sense that people can grab hold of and embrace. Hopefully they can do that. I wonder, we will be talking about the vaccines throughout the webinar. Is there a word of advice or wisdom that you have about getting vaccinated? There may be up to 4 vaccines available soon. Right now there's 3 available. Any words that you have for those listening about taking the vaccine when it becomes available, or any words of wisdom as it relates to getting vaccinated?
Sure. Well, we have 3 vaccines that are authorized as of the time that we're talking, one from Pfizer and one from Moderna. These are the 2-dose vaccines. Then we have the one-dose vaccine from Johnson & Johnson. AstraZeneca may be submitting for authorization from the FDA, but that vaccine is probably not going to be available until May. And so for all intents and purposes, we're talking about the 2-dose Pfizer and Moderna, or the 1-dose Johnson & Johnson vaccine. I think the most important thing that I want to say about these vaccines is that they're all extremely effective at the endpoint that really matters, which is the endpoint of preventing severe illness. Then there are certain benefits of all these different types of vaccines. The Johnson & Johnson vaccine is a 1-dose vaccine, and I know that I have many patients who would prefer to have 1 dose and be one and done, instead of scheduling another appointment, coming all the way back for that appointment to a testing site or to a vaccination site. And so I think the key is, I would really recommend for people to get the vaccine that you first have access to, recognizing that that is not going to be your last say on the vaccine. As in, it may well be that because of all the variants we have, that we're going to need a booster shot that specifically targets these variants. You may be able to get the booster shot from another company. It's not like if you commit to Pfizer or Moderna, that's the vaccine that you have to commit to for the rest of your life. I mean, think about all the flu vaccines that we get every year. I never ask, and I don't know if you do, ask what is the manufacturer of that vaccine? We mix and match vaccines all the time. Now, don't get me wrong, if you get the Pfizer vaccine for the first shot, you should get Pfizer for your second shot, Moderna for the first shot, Moderna for the second shot. But after your initial vaccine, in the future, you may be able to get another vaccine. So get whatever vaccine comes your way first, because you want to get that level of immune protection into you as soon as possible.
That was so incredibly helpful. Thank you. I actually had that question and have been wondering, you know, are you stuck with getting the same one for the second time? And so that was incredibly helpful. We thank you so much for your time. We will hope to figure out a way to have you back. You are just a wealth of knowledge. And this really, I think, clears up some of the main questions that we've been getting, at least about the vaccine, about staying safe, about wearing masks, and about potentially going back to worship. So thank you, Dr. Wen, and we look forward to seeing you again soon.
Thank you very much. And I just wanted to say thank you again to all of you for your wonderful work. There is an aphorism in public health about how it's not the message, but the messenger that really matters. And in this case, we know that our clergy, our pastors, our rabbis, our imams, all the people in the religious community, you are going to be the most credible messenger to so many people who look up to you, to so many millions of Americans. And so, as it has been during the entire pandemic, I really look to you to partner as we get out the word and improve public health. So thank you.
Well, thank you. And we look to you, and we're so glad you were able to join us today. Thank you so much.
Thank you.